welcome back to our channel. I'm Catherine Chong, your fertility dietitian dedicated to helping you to navigate your fertility journey. Now today we are chatting about whether you can ovulate naturally with PCOS. Before we get started, if you are new here, please subscribe to our channel and give this video a thumbs up if you find it helpful. Now, many women with PCOS trying to conceive often face issues with ovulation, and this is something I frequently see as one of the most common infertility issues for clients with PCOS. So PCOS, also known as Polycystic Ovarian Syndrome, it's a common hormonal disorder that affects up to 10% of women of reproductive age. It is characterized by irregular menstruation, ovaries with small cysts, and high levels of androgens, also known as male hormones. So all these syndromes can all affect menstruation patterns as well as ovulation. While PCOS can present with an array of symptoms, one of the most significant concerns for women with PCOS is the impact it has on fertility. Like I mentioned before, PCOS can cause irregular ovulation and hormonal imbalances, often due to insulin resistance, which can make it challenging to get pregnant. The good news is dietary and lifestyle changes can significantly help to improve PCOS and improve your chances of conceiving naturally. So let's dive in now how exactly dietary and lifestyle management can help to restore ovulation and improve your fertility. So here are the 3 things I want you to learn today. First, switch to low GI foods. The glycemic index, also known as GI, is a ranking system to measure how quickly the food raises blood sugar levels. Low GI foods cause a slower and more gradual rise in blood sugar level. Ideally, we want you to have more of the low GI food. The reason being, these can help manage insulin level, which can be a common issue in women with PCOS. This helps to create a more stable hormone environment and also a much more regulated sugar control, supporting regular ovulations and fertility. Now, low GI foods include most whole fruits and vegetables, beans, minimally processed grains, pasta, dairy foods, and nuts. It's also essential to keep in mind that low GI foods should only be consumed in moderation. Next, follow a Mediterranean eating pattern. This diet is rich in fruits, vegetables, whole grains, lean protein, and healthy fats like olive oil and nuts. The Mediterranean diet is also known for its anti-inflammatory properties and its many benefits to fertility. This diet can help reduce inflammation associated with PCOS, creating a more viable reproductive environment. The Mediterranean diet is also largely made up of low GI and highly antioxidant food, which are essential for supporting egg health and quality. And lastly, do also consider taking an Anoco supplements. Inositol is a natural occurring sugar compound shown in research to help improve insulin sensitivity and ovulation in women with PCOS. There are many forms of inositol, and there are 2 most researched forms of inositol are myo-inositol and dichiro-inositol. These supplements may be helpful to improve metabolic health, hormonal balance, and as well as helping women with PCOS to restore ovulations and improve the chances of conception. However, if you're thinking about starting inositol supplements, making sure that you consult with a fertility dietitian to help to determine what is the right dose as well as the safe brand for you to consume. Now, if you want to dive further into this topic, don't forget to check out our previous episode on the 3 best diet tips for getting pregnant with PCOS. And if you enjoyed today's episode, don't forget to subscribe, like, and comment below if you have any questions for me. Until then, bye for now.